Thank you very much for the introduction, and thank you to the conference organisers for the invitation to come and speak. It's a real pleasure to be here and to be in Toronto and to join your conference. I am going to share some of our experience at the Terrence Higgins Trust in the UK of developing a national campaign to turn the U equals U message into a more digestible form to share that really important story. Just in terms of disclosures, my key ones are that I've received honoraria from Gilead for talking about U equals U at a number of meetings, and the second part of the campaign that I'm going to tell you about, the Can't Pass It On campaign, was also funded by a grant from Gilead Sciences. Now, my talk is going to be relatively data light. It's going to be very data light, but I think it's important to start by reflecting on the fact that the point that we've reached at in terms of the messaging around U equals U is built on a foundation of more than 2 decades worth of academic research, clinical evidence, and expert opinion, built fundamentally on our knowledge about the fact that viral load is the single biggest determinant of HIV transmission. So the higher the viral load, the more likely a transmission is to occur, and the lower the viral load, the less likely a transmission is to occur. And we've had mention already of the HPTN 052 study, but I think it's really, and certainly for us in terms of our thinking around this campaign, the partner study, which was the tipping point that got us to a point of confidence about being definitive about the language that we use around U equals U with individuals who are living with at risk of HIV. Both Partner 1, which was published in 2016, and Partner 2, looking at men who have sex with men, which was presented at the IAS conference earlier this year. So just a refresher or a reminder of those 2 studies, Partner 1 and Partner 2, both a similar design in the sense that they recruited different couples, where one partner was positive but on effective treatment with an undetectable viral load, defined as a viral load of less than 200, with a negative regular partner. And Partner 1 published the data on 888 of those couples, all of whom contributed over 1,200 couple years of follow-up to the analysis, reported nearly 60,000 episodes of condomless anal sex, and there were 0 transmissions which were linked to the positive partner. An important fact from the partner study, both 1 and 2, is that there were transmissions in that study. In Partner 1, there were 11 initially HIV-negative individuals who became HIV positive, but all of those were infected from sexual partners outside of that primary relationship. So that study gave a result of 0 linked transmissions in the context of a sustained undetectable viral load. Also importantly, whilst this wasn't a sort of confirmed sexually transmitted infections, that was in the context of a reasonable amount of reported sexual transmitted infections. There were still 0 transmissions. So really solid evidence from Partner 1. The caveat around that just 1/3 of those couples were men who have sex with men, so the data was perhaps less solid for men who have sex with men than it was for heterosexual couples, which is why Partner 2 was continued, looking only at men who have sex with men couples. And that reported, as I said earlier this year, data on 1,600 couple years of follow-up. That's about 782 couples altogether, reporting 77,000 condomless anal sex acts and 0 linked transmissions to the primary positive partner who had an undetectable viral load. And again, in that study, we saw 15 infections, but all of which came from sexual partnerships outside of that relationship, and a higher rate of reported sexually transmitted infections, which gave us the confidence for men who have sex with men that we already had for heterosexual couples, both from Partner 1 and from HPTN 052. So John's already touched on this, and I don't think I need to really say probably to this audience how hugely significant this message is for individuals living with or at risk of or affected by HIV. It reduces the shame and the fear around sexual transmission, is a huge, or potentially a huge way to tackle stigma against people living with HIV. It simplifies the concept of conception. We don't have to worry about sperm washing or PrEP around the time of conception or timed conception. and is a really strong message, a very strong message, to add to our strong message about the benefits of early diagnosis and treatment on the individual and on their ability to achieve a long and healthy life, to encourage people to not only test, but then also to engage in care and to stay on treatment and adhere well. It's also a very strong public health and policy argument to continue our campaigns to ensure universal access to testing for all of those groups who are at risk of HIV and a continued investment in high-quality treatment and care services. So our thinking around the Can't Pass It On campaign started, it's about 2 years ago now, towards the end of 2016, so a few months after the Prevention Access U=U consensus statement and a few months after Partner 1 was published. And for us as an organisation, there were a number of reasons why we felt it was important to step up and start to share this message. Clearly at that point, and I think probably you could say that most of these still apply now, there was very little awareness or understanding about the U=U message amongst people who are living with HIV. Amongst healthcare professionals or people working in the sector, there was certainly very little consensus about our approach to that messaging and what the language we should use around U=U. There was very little, if any, awareness in the general population, and we felt it was really a responsibility for us as a national HIV organisation to share this essential message with both with people living with or at risk of HIV and the general population. So we did some work to start to design the campaign. There were kind of 4 aims of the campaign. 1 was to challenge stigma. 2 was to amplify and share the messages around the partner study. 3 was to show as an organisation real leadership and confidence, both internally within our organisation, where there was still some conflicting views about how we should share this message, but as well outside of the organisation. And particularly, as I'll show a little bit later, to ensure that the voices of people living with HIV were front and central to the campaign. Just to put some context, during the course of both before and after, and repeated again this year, we've done some national surveys which are undertaken by YouGov, which is a major polling organisation in the UK, and this just demonstrates where we're at, or where we were at, certainly. So this is from 2017, where only 9% of the general population were aware that people on effective HIV treatment can't pass the virus on. So just to tell you a little bit about the campaign, so as I said, it initially launched in 2017, and our starting point was taking the undetectable equals untransmittable message and turning it into something that was more clear, concise, and easily understood, because the words undetectable and untransmittable are terminologies that are not particularly accessible, probably, to most people who are working outside of a clinical setting. Our process was one that started with sort of brainstorming and internal consultation within the organisation, and then online focus group testing of a number of different messages. So we got to Can't Pass It On through a phase. It's quite interesting reflecting back on some of the things that we suggested using, which are a little bit embarrassing now, it must be said. But anyway, at the beginning, we had phrases like, yes, we're sure, this changes everything, won't pass it on, or can't be passed. And they distilled down into 2 key messages which tested the best. One was, I'm not a risk, which is a very individual approach to the messaging. And the second one, which we ended up choosing, Can't Pass It On, which is a more general message. And Can't Pass It On won. They both scored very highly, but I'm not a risk scored much more highly amongst people who are living with HIV. And Can't Pass It On scored much more highly amongst the general population. In terms of believability, in terms of reducing stigma, and particularly in terms of people's likelihood to share the message. And that was really key, because fundamental to the campaign was sharing it predominantly through social media. So that's why we went with Can't Pass It On. And we distilled the messages into very simple infographics, as the one you can see here, which is a summary of the partner study, and very simple messaging. You know, people on effective HIV treatment cannot pass on the virus. But we recognised that we needed to provide more information and layers of information. So the campaign was designed, as I say, in a slightly hierarchical way. So there was the very simple way in, #Can't Pass It On, and that was launched with a dedicated website supported by various press and social media pushes. But on the website, and certainly in terms of our messaging, there was increasing levels of information that sat behind Can't Pass It On. So the first level was just a general a description or explanation of what we meant by that, what we meant by effective treatment, what we meant by an undetectable viral load. Then what sat behind that was more detailed, frequently asked questions. And then what sat behind that, if people wanted to go all the way through the tiers of information, was a detailed summary written by myself around of all the scientific data going right back to studies like the Rakai study 20 years ago. So there were different points of entry and a tier, if you like, of information that people could get around the campaign. So I said it was launched in summer 2017, and it was launched particularly to coincide with our Pride events in London, and supported by a campaign out through media releases, through written press, through TV, and through social media, which I'll show you shortly was a really fundamental component to the campaign. That was in 2017, and then we relaunched the campaign with some different imagery and a slightly different approach in 2018 as a result of a grant from Gilead. As I said, one of the key aims was to ensure that people living with HIV were front and centre of the campaign. And I think this is probably the single biggest reason why it has been as successful as it has. We had 38 individuals living with HIV who gave their own individual testimonies. There's a couple of examples here, which were both in terms of little statements that could be used on social media or in press releases, or more longer written testimonials, or many of these individuals were involved in interviews for the press or on television. So those 38 individuals were a real hook for the huge amount of media coverage we got for the campaign, which resulted in around 20.47 million people being able to view the message through various different media outlets. There's some examples of the individuals and the outlets here. So there was a lot of online coverage. There was coverage in the written press. There was interviews on the television, and a lot of spreading of the message through social media, Twitter, Instagram, and Facebook predominantly. So we had a burst in 2007, and then we were keen to sort of refresh the campaign this year. So Can't Pass It On stays and will remain our sort of tagline or a hashtag or a hook for the campaign. We redid the imagery this year. There's a couple of examples there of real people, real couples in serodifferent relationships. So real lives and real testimony remained central to the campaign. We also this year had much more of a sort of out-of-home visibility. So that's a billboard that's it's a huge billboard in Vauxhall, which is in South London, which is kind of the epicenter of where our HIV epidemic in London and therefore in the UK is, because it has a high concentration both of men who have sex with men living in that borough and also of African, Caribbean and black individuals. So we had billboard campaigns, we had things over telephone boxes on the side of buses, so slightly different from the first year in the sense that it was more out-of-home advertising. And we sort of ramped up, if you like, the information that people could access themselves. So there's a dedicated website where all of the information exists, and also there are video testimonials from some of the individuals that were involved in the campaign. And if you're interested, you can find this by simply Googling either Terrence Higgins Trust or Can't Pass It On. All of the resources are available. There's no copyright on them, so you're very welcome to take them and use them. And there's a sort of a social media pack that you can download with imageries that can be pushed out on Facebook and Instagram and Twitter and so forth. So just a little bit of numbers, if you like. Interestingly, I mean, we have, this is testament to their skill, a very small but very expert marketing, and particularly social media marketing team at Terrence Higgins Trust, who are very good at spreading message to target communities as well as the general population through social media. So actually our biggest impact came through organic social media, which was unpaid for. We actually paid very little for paid advertising for this campaign. And there's just some examples there. So the hashtag Can't Pass It On has been used almost 3,500 times on Twitter. Just between July and September of this year, that total reach of that hashtag was over 10 million. Our own personal use of it through the THT Twitter, Facebook, and Instagram pages has been over 250,000. It's been shared and liked on Instagram 1,000 times, 138,000 unique users on Facebook. And one of the other things that is important, and this goes back to talk in the prep session, was the support of a number of our parliamentarians and them getting the message out and tweeting and sharing that message as well. As I said, we did do a little bit of paid-for advertising through Google and Facebook predominantly, which did get us some extra reach, but actually, interestingly, it wasn't as much as the organic reach that we got. So in the first campaign, we reached 600,000 men who have sex with men and black African individuals. The second push, a little bit smaller, 76,000. Over 1 million impressions with over 1,000 click-throughs on Google through paid advertising. And we did some targeted Facebook adverts around Can't Pass It On, which received over 2,000 click-throughs. Visibility of the message has been really important. So these are some images from our last 2 London Prides. So Terrence Higgins Trust has marched under the Can't Pass It On banner in 2018 and in 2017. And that's been a really powerful thing to keep the visibility up and to extend the reach of the message. So as well as the march, we've done it not just in London, but at probably most of the Prides around the UK. We had a presence on the stage at Pride with people living with HIV talking about the importance of the message, and that's been a really powerful way for us to share the word. It's important for us to evaluate and learn about what we do. So here's just a little bit of the data in terms of knowledge and recognition. So before the campaign, about 70% of the men who have sex with men or black Africans that we consulted knew about the Can't Pass It On message, and that went up to 80% after the campaign, with a 40% prompted recognition in the general population, which is actually really good, I think, for a relatively small, certainly smallly resourced campaign coming from a very challenging standing point of maybe 10% of the population actually knowing about that message. So our learning from it, just to distill down into a few points, is I think fundamental to its success has been the initial consultation. We don't come up with these campaigns in an ivory tower and in isolation. We consult with the individuals that we are trying to get that message to make sure that the message was right and as impactful as possible. As I've said, the personal testimony was, I think, the single most powerful hook for the campaign and the thing that got it the most traction. A sort of tiered and coordinated multimedia approach, and particularly the targeting through social media, got a reach well beyond what we would have been able to do if we just used traditional marketing or media approaches. And the definitive and simple language was really key. And it's just on that point that I will finish, because I think that, for me, is the most important thing for all of us working in the sector, whether we're talking to colleagues or people living with HIV or people at risk of HIV or friends or the general public. We have reached a point that the data is as definitive as it will ever be, so that we can use language like zero, can't and won't, not, maybe, extremely unlikely, nearly impossible, or close to zero. And I put a quote there. I put a quote there from Alison Roger, who's a friend and colleague of mine and the principal author on the partner study who presented the data at IAS. The last bullet point on her final slide at the presentation were the words undetectable equals untransmittable. And when asked by another genius in the field, Bruce Rickman, she replied in the Q&A after the presentation, "It is very, very clear that the risk is zero. If you're on suppressive ART, you are sexually non-infectious. The time for excuses is over." Thanks very much for your attention.